Hey everybody, redo time. I was doing a video and I started sneezing so much I had to just cancel, start over. So let's jump into, again, the discussion of mercury. Mercury is a toxic substance that can get into our bodies and cause a lot of mischief. Um, what might the symptoms be? The symptoms are quite diverse. I mostly associate mercury with pains. My shoulder hurts, my back hurts. Usually no injury, so why is my foot hurting? Why is my knee hurting? Why do I have neck pain or head pain? So it causes lots of pains, and it causes lots of nerve problems. So the problems can be, I feel like I'm having panic attacks. I can't think straight. I can't remember. I have sensations of ants all over my skin. I feel like there's wind blowing on my skin. I feel cold. I am starting to be paranoid. So mercury causes a lot of problems with nerves and the brain. So it's no fun. Nobody wants to have pain and nobody wants to have brain or nerve dysfunction. So the trouble is, mainstream medicine does not test for mercury toxicity often or well. So it needs to be tested for. And that's what I do at this office. I try to test for mercury. I screen for it with applied kinesiology testing on everybody that comes in. And of course, it doesn't show up on everybody, but on the patients that seem to be, hey, I have this weird, difficult problem, it can show up. It usually is not involved with something like, oh, I just started having this problem yesterday. It's more involved with chronic stuff and weird and difficult problems. So if we find mercury, what do we do about it? What do we need to detox it? That hinges on the liver and the kidneys working well first. So you don't want to start detoxing if the liver's not doing that well or if the kidneys are not doing that well. So you need to make sure that they're doing okay. If they are, let's begin. And usually that involves taking some substance that could be called a chelating agent. And that it just means it's some type of mineral or a product that when you take it by mouth, gets into your stomach, usually absorbs into the blood, although one of them that I use doesn't. Sometimes it can just stay in the stomach and pass through. But a lot of them get absorbed into the blood. And then what that does is that kind of pulls the toxin out of storage, and then it makes its way towards the kidneys or the liver to be excreted. So I find that this process is not what you hear about in other literature. You may hear people saying, oh, it takes about 1 to 2 years to detox mercury. In my experience, if you make sure that the liver and kidneys are doing okay and take care of some of the basics, the detoxing process takes 1 to 2 months. So about 25% of the mercury leaves every 2 weeks, in my experience. Um, and the products are usually some minerals or some charcoal powder or a combination of a couple of things. And the price is ridiculously low. It's usually somewhere around $20 for a bottle of something that is it's customized for you, what you need to find out what you need to help pull this mercury out of your body. And these minerals are cheap. Charcoal powder is cheap. You just need to know which one is the right one for you and how much to take, and then supervise. Every 2 weeks, I like to recheck people to see how you're doing, because you could be detoxing like gangbusters for a week or two, and then it plateaus because the kidneys are getting overloaded. In that case, you may want to support the kidneys again, find out what the kidneys need, and then the detoxing picks up again and speeds up. That's why things go very quickly with me, is because we customize what you need, and then we take care to check, is anything getting overloaded? Is there a bottleneck being created in some place? If there is, then you're in a 2 year, very slow type protocol. I don't use a lot of the heavy detoxing agents that you might hear about, like EDTA and some of the others. There's no need, in my opinion, for doing IV type chelation therapy. In fact, chelation therapy implies intravenous. I find it expensive and ineffective. With just taking oral products, something by mouth, minerals, different things, 1 to 2 months. And that's much more fun and smooth and less invasive and less costly than chelation therapy. I had a patient a few years ago that said, hey, I've done a year's worth of chelation therapy. And I said, well, how did that go? And she said, I feel the same. I know I have mercury. I've spent thousands of dollars, something, if I recall, about $20,000 to $30,000 on chelation therapy weekly, so 52 times. I checked her, and it seemed like she had as much mercury as high level of mercury. So it did not seem to be effective in her case. In other people's cases, it may be. But generally, I find if you take something by mouth correctly, the right product, it's pretty fast, 1 to 2 months. And the smooth. People are not going on a roller coaster of uncomfortable symptoms. Now, there's another question of where does the mercury come from? The most common source that it comes from is from the mouth. Dentists in the United States and other countries, less in other countries, have used mercury amalgam or silver amalgam fillings. It's 50% silver, about 50% mercury, and then they put these to fill cavities. However, the mercury leaks out slowly over time and gets in our tissues and our joints and our brain, and then those areas start having troubles. So it is a good idea to identify if maybe you have a filling or 2 or 10 that are causing trouble. And in that case, you want to remove the filling and fill it with something non-toxic. I found also with fillings that I like to use applied kinesiology, muscle testing, to find out which filling you need to remove first. You don't want to go in willy-nilly, just random, hey, let's start with this one, or let's do all the top teeth this week. You want to remove the correct filling 1 per month. So you want to remove the worst one usually, month 1, and recover, and then you want to remove the next worst one, month 2, and then recover. So I like to work between me and a holistic dentist or a good dentist who's great with amalgam replacement. And that's basically it. You want to identify what it is, you want to start detoxing your body, and you want to make sure there's not something remaining that keeps putting more into your body again. Because some people get caught up into like, hey, let me have all my fillings replaced. Well, that's great. That's a good idea. But did you remove the mercury from your body? You may have removed a potential source, but a lot of that mercury is already leaked out, and it's in your brain or your bones or your muscle tissues or tendons. And so you can have all your fillings out and still feel bad because there's the mercury that left and it's already in your brain or it's in your heart or wherever. So you want to do both. You want to remove the fillings and you want to do the detoxing. Hope that was informative. Give the office a call. Hope to see you soon.